Good afternoon. County Executive Rich Fitzgerald here, giving our weekly update on COVID-19, and with Dr. Deborah Bogan of the Allegheny County Health Department. And when Dr. Bogan gives her report today, the numbers can continue to get better. More and more people are becoming vaccinated, particularly in our senior population, which has been our most vulnerable population. And the numbers are slowly but climbing up in the younger population. And that's something I think we do need to work on, as we have roughly 75%, almost 3/4 of the adult population with at least one dose of the vaccine. And obviously we want to get everybody protected as we can. So let me turn it over to Dr. Bogan to give her weekly update. Dr. Bogan.
Thank you, County Executive, and thank you for joining us again today. I start again with encouraging news. We're now averaging fewer than 50 new COVID-19 cases a day. Just 2 months ago, we were stuck in a fourth surge and averaging more than 450 new cases a day. And we have not had a daily total above 100 since May 21st. Hospitalizations and deaths are also at levels we've not seen since late October or early November of 2020, and the PCR positivity rate is at its lowest point in more than 6 months at about 3%. Much of the credit of this rapidly improving situation goes to our vaccines. They work, they protect us from serious effects of COVID, and they're helping us get back to the world we knew pre-pandemic. It's interesting, over the holiday weekend, I saw a number of reports from around the country about new incentives for people to get vaccinated. In Ohio, the government recently paid $1 million to the state's second vaccine lottery winner and announced the second winner of a full college scholarship for people ages 12 to 17. CVS also just announced over 1,000 prizes to people who get vaccinated through the company, including cash, cruises, Bermuda vacations, and a VIP trip to the Super Bowl in Los Angeles. Kroger is also getting involved by giving away $1 million to 5 people and free groceries for a year to 50 people who can enter the contest only if they get vaccinated. I know how crucial it is in the fight against COVID to get as many people as possible vaccinated. So I really applaud the creative approaches to getting shots into arms. Sadly, I don't have $1 million laying around to offer as an incentive, not even a trip to the Super Bowl. But I do have this, a reminder of the best incentives to get vaccinated. For your own safety, for your loved one's safety, for a return to normal, for wresting control of our lives away from the virus and putting it back in our hands. So I'll get to my weekly reminder out of the way now. Please go get vaccinated. You don't need an appointment. You can just walk into any health department vaccination site or any community vaccination site and get vaccinated. If you need help with transportation, you can call 211 and help will be provided. And if you have a loved one who hasn't been vaccinated yet, I urge you to please encourage them to do so. This allows me now to provide an update on our efforts to promote and support vaccine confidence. As we previously announced, the Health Department allocated a share of its CARES Act funding to Yo Mama's House Productions to develop a series of videos and messages that share stories of safety, resilience, and hope in our communities of color. The partnership resulted in Co-Victory, a project that highlights stories of victors living in or connected to Allegheny County who are staying strong in the fight for health amid a pandemic. The pandemic underscored the health disparities affecting these communities. National studies show that non-white, socioeconomically disadvantaged, and non-English speaking populations shoulder disproportionate COVID-19 burdens, a trend that is repeated in Allegheny County's Black, Brown, immigrant, refugee, LGBTQ, and non-English speaking populations. We wanted messaging designed specifically for these communities. These are positive stories which speak to both the trials of the past year and the triumphs of surviving it. I hope these stories inspire people to keep up the fight against COVID transmission, to get vaccinated, and to encourage others to do the same. And I encourage everyone to watch and listen to these amazing stories of courage and resilience at covictories.org. In terms of vaccination rates, we continue to see slow but steady gains. As of this week, nearly all people 65 and older in Allegheny County are at least partially vaccinated, a tremendous and important milestone. For people 35 to 49 and 50 to 64, the rates are both 72%, and for people 20 to 34, 61%. Rates also continue to improve among our youth, with 41% of people 15 to 19 at least partially vaccinated, and 13% people 12 to 14. So the light at the end of the tunnel is getting brighter. I myself recently noticed a change for the better last week when I got to work here at the health department. For over a year, signs on our front door announced that anyone wishing to enter must wear a mask. Those signs are gone from our non-clinical buildings, replaced with new signs stating that in accordance with CDC guidance, masks are no longer required for those who are fully vaccinated. That was certainly a welcome sight. So before we open the briefing for questions, a quick reminder of some changes in how we will be reporting COVID-19. Updates will be given every Monday, Wednesday, and Friday. Some of the information included in the updates, such as age ranges, will no longer be reported, but the core information, cases and deaths, plus the running totals since March 2020 will continue to be provided. Likewise, the online dashboard will be updated Monday, Wednesday, and Friday rather than daily. Also, our briefings will now be held every other Wednesday. These changes will help us focus more energy on business in the health department, matters that are important for our community, well-being, and health. Of course, running a health department during a pandemic has reminded me of the importance of being adaptive and responding quickly. So if the situation changes, we will as well. But I choose to move forward with optimism. We're headed in the right direction, and I believe we will continue to do so. So I thank you for your time. Please be safe and be kind.
Our first question is from WTAE. Has there been any concern raised or signs of new cases following Memorial Day weekend? And is that something you expect to see in the next few days?
So as always, we do track information about exposures, and we have not yet had a big anything coming in about Memorial Day, but we'll continue to watch that. I'm not sure if we'll see a bump or not. We do have lots of people vaccinated and more people getting so every day. It's also warmer weather. People are more outdoors. So we'll just have to see. As always, we follow the data and let the data lead us on guidance.
This next question is from the Post-Gazette. Can you tell us about what the county's plans are to address vaccine hesitancy in this last phase of the pandemic?
Well, you just heard my comments, and I've been talking about vaccine and switching from vaccine hesitancy to talking about vaccine confidence, because now that we've had over 100 million people vaccinated, we have lots of confidence in these vaccines. So we at the health department, along with lots of other groups, continue to provide information to the public. And I ask that all of you really share the truth about vaccines and try to really dispel the misinformation that is out there about vaccines. And so it's all of our jobs to make sure that the public understands the truth, which is these vaccines are incredibly safe and remarkably effective.
This next question is from WTAE. While the number of new cases has dropped, a significant amount of today's new cases, 18 to 42, are in the age 25 to 49 age group. And if we expand that to 19 to 49, it's 27 out of 42. Do you have any particular message for people between the ages of 19 and 49?
Sure. So a couple things about the younger age groups. First of all, as I reported the rates of vaccination, it was clear that the oldest groups are the most vaccinated, and the younger you get, the lower the rates of vaccination. So my first message is please go get your vaccine if you're younger. The other thing is that I think over the pandemic, we've all messaged that younger people fare better in this vaccine and that they don't actually get particularly sick, they don't get hospitalized at the same rates, and they certainly don't die at the same rates. But I've been following these numbers closely, and it's very sad. If you look in the month of May, this virus can affect really young people very seriously. Again, the risk is lower, but it's not zero, and it's not insignificant. So in the month of May, if you look at those 25 to 49, we lost about 2 people a week in that age range in our county to COVID-19. And if you look at 50 to 64, it was closer to 5 people a week. So although, again, I think we just need to be clear that it is not as high risk as if you're 85 or 90 when you get this, but there are young people dying of this virus, and they are getting hospitalized as well. So again, I encourage you all, if you're young and healthy, please go get your vaccines. It makes a difference for you. It's tragic that we lose people in their 30s, 40s, 50s, 60s to a disease that we know we can prevent with a vaccine.
From the Post-Gazette, how does the health department address concerns from parents about vaccinating their children?
Yeah, so vaccines are part of our world, and if you look back, my mother, who was born in the early 1920s, talked when I was a child a lot about polio and diphtheria and all the childhood illnesses that she lost her friends and family to. And we're very fortunate to live in an era where most people in our community have never seen these vaccine preventable illnesses. And I hope in the future, that people will remember that, because we do have a vaccine for those 12 and older, and soon we'll have a vaccine that goes even for younger people. So I encourage families to recognize that we have lots of data on even the 12 to 17 now. These vaccines are very, very safe, and they're very effective, and they protect the children, and they protect the people around them. So again, vaccines are part of our world. They've changed our world over the last century, and we really need to keep that in mind as we think about this new vaccine as well.
And this final question is from WTAE. How's the county health department looking ahead to June 28th, which is the latest date that Pennsylvania's mask mandate will lift? Is the health department considering any guidance for masking in certain situations even after the mandate lifts? And if so, what would those situations be?
Yeah, so again, here at the health department, those of us who are vaccinated, which is almost all of us, are walking around in the building as if without our masks on, and it's been great. The more people we have vaccinated in our community, the more that will be fine. And so right now, we're gonna wait and see what happens. I suspect we will do great, because we do have a lot of people vaccinated in the county. Not enough, but lots, and more than other places. As always, our decisions at the health department are based on the data and the science. So I make no predictions. I wait and see what the data show us, and decide at the time if we need to do anything. But at this point, we'll wait and see. And I'm happily walking around the health department all day without my mask, which is great.
And that was the final question, if there's any closing remarks.
Well, Dr. Bogan, while you don't have $1 million to give out, you've been giving this community much more than $1 million worth of advice and worth of help over this last year and a few months. We've weathered a very difficult time over these last 15 months. Not that I don't like being here every Wednesday, but I was hopeful of this day in which we could skip and say we're going to go to every 2 weeks, because what that really is a sign that we're heading in a good direction. Although we do know that over 100,000 people of our county have been infected, and we know it's more than that. Those are the ones that have tested positive that have been recorded. We also know close to 2,000 of our fellow Allegheny County residents have succumbed to this deadly disease. So we still have some work to do. As Dr. Bogan said, when you think about some of the diseases of generations ago that basically have been eradicated by vaccinations that have occurred, some of them right here in Pittsburgh with polio that has happened. So we're very close. That last 25%, we really want to have everybody reach out to those folks. And as Dr. Bogan indicated, the numbers between 12 and 14 and 15 and 19 are the folks that need the vaccinations most. I was around a lot of places on Monday at a lot of events. Many of the folks that were there were seniors, and you could just, the smiles on their faces to be out and about in a crowd of people for the first time in almost a year and a half was joyful. And to see people that were able to commemorate our fallen heroes on Memorial Day, as they were, somber for that, but happy to be with their neighbors and to be out and about. So we want to make sure that we get that last 25% of folks vaccinated. The health department and our health partners have injected over almost 1.3 million shots into the arms of people in Allegheny County. Over 500,000 people have been fully vaccinated, and another 200,000 up to almost 750,000 have at least partially been vaccinated here in the county. Again, we want to get those younger folks that haven't been vaccinated, and even the ones from 35 to 64 who haven't been vaccinated as well. So let's keep working to get as safe and healthy as we can. It does feel good, as Dr. Bogan said, to walk around the office without the mask, as all of our folks in my office have also been vaccinated. It does give you that sense of relief and that sense of freedom that we all enjoy. So as I used to say every single week, but I won't say it this week, I won't see you next week, but we'll see you in 2 weeks. Stay healthy and